Kenya is currently ranked in the top 20 high-burdened countries with the highest rates of cervical cancer in women of reproductive age. Most women are said to be diagnosed at the latest stage of the disease. Cervical cancer is preventable and treatable when detected early. Sadly, 9 women die daily, with 5,000 new diagnoses made annually. It is based on these worrying statistics that the government seeks to increase awareness and voluntary participation in cervical cancer prevention.
This event brings much hope because we have heard stories of untold suffering, emotional trauma, and increased financial burden of women and their families. The government has called on coordinated multisectoral efforts to implement the 90-70-90 targets to achieve a reduction in mortality from cervical cancer.
The advocacy guide launched Thursday seeks to have 90% vaccination rate for all eligible girls, 70% screening for all women who are of reproductive age, and 90% of infections treated.
Our work continues to support community education programs, which are key strategies to ensure nationwide prevention and control of cancer.
The recent intervention to have school-going girls vaccinated against human papillomavirus has currently seen 350,000 girls receive vaccination against a target of 800,000 girls.
That our cervical cancer screening coverage has remained low, at only 16.4% of all our eligible women. Challenges such as stigma, misconceptions about cervical cancer screening, lack of adequate staffing and capacity for screening, inadequate commodities and supplies for screening continue to hamper efforts in scaling up screening for cervical cancer.
It is launched.
The advocacy guide will see communities engaged at different levels to ensure people show up to utilize the resources allocated towards cervical cancer elimination.
The biggest challenge that we encounter is actually lack of information, and that's what this toolkit is addressing. Because people assume cervical cancer is a woman's affair. It is not. It's a family affair, it's a community affair. So that lack of awareness that it's preventable, that lack of awareness that it's treatable if discovered early, that lack of awareness that people should not wait for signs and symptoms, but should go to get screened even before they have the signs and symptoms.
Meanwhile, the University of Manchester and Christie NHS Foundation Trust will collaborate with Kenyatta University Teaching, Research and Referral Hospital in the prevention and management of non-communicable diseases, with special emphasis on cancer and mental health. President Uhuru Kenyatta on Thursday held talks with visiting officials of the University of Manchester and Christie NHS Foundation, where it was agreed to establish a strategic partnership aimed at strengthening healthcare sector in the country. The agreement provides for the training as well as exchange of health professionals, including Kenyan nurses, who will get an opportunity to serve in Britain. Kamchemenza for Channel 1 News.